Good afternoon, good morning, good evening. From wherever you're joining us, I want to welcome you to this conversation today where we're going to talk about HIV/AIDS and specifically have and share thoughts around the celebration or commemoration of World Health AIDS Day. This year's theme is putting ourselves to the test, achieving equity to end HIV. Now, the world continues to grapple with the HIV/AIDS epidemic. Since the discovery of the first cases, the United Nations AIDS Organization estimates that 40.1 million people have died from AIDS-related illnesses around the world. And the most affected of these people are Black, drug users, and individuals in the LGBTQI community. Today, we will focus on this conversation on the impact of the disease in African American and Black communities. I have a panel of experts that I will introduce shortly who are going to help me with this conversation. So sit back and relax as we continue with our conversation today. So I have two special guests that are joining me on this panel as we share our thoughts on HIV/AIDS epidemic in the Black community here in the US and around the world. So I am joined by Mr. Ndhlovu, who is the pre-exposure prophylaxis manager for the state of Indiana. Mr. Ndhlovu, I want to welcome you to our conversation today.
Thank you. It's a pleasure to be here to share these special moments that affect us all. Thank you.
Awesome. Thank you so much. Another guest joining us today is Miss Ebony Crawford, who currently works as a disease intervention specialist in Indiana. And a little bit about Miss Crawford. Her career has had her work for over 20 years with a group of diverse individuals, and she's worked in the educational system, criminal justice system, and she's worked also with individuals that are addicted, and now she works on prevention of diseases such as STDs and HIV/AIDS. So she says that her goal is to help people of color to fight for equity and equality, for healthcare and community resources to assist in having a healthier and better overall life. Ebony, I want to welcome you to our conversation today.
Thank you so much for
Awesome.
having me. I
Great.
appreciate you guys having me. Thank you.
Thank you. So before we start the conversation, I just want to read from what the UN AIDS global website says. So they released a report recently, and it is called In Danger. And in that report, they say that an HIV response is faltering in the work of the COVID-19 pandemic, the global economic crisis, and the war in Ukraine. A total of 650,000 people died of AIDS-related illnesses in 2021, and there were 1.5 million new HIV infections. 1.5 million new HIV infections. That's 1 million above the target that they set for 2020 of 500,000 people. So new HIV infections increased in 38 countries. With this data, it should make everybody stand up and say, what is happening, And this is where we're picking our conversation from today. Mr. Ndhlovu and Ms. Ebony, could you tell us what the state of HIV/AIDS is in the Black community?
Yeah, so thank you, Dr. Sombo, for that question. The state of HIV and AIDS in the Black community, it's very, very high. And it's very important for us as Black people to make sure that at least we're doing our due diligence to ensure that at least we are promoting education, doing the education campaigns to promote access, because I think at the core of HIV is access. And access in most cases is as a result of poverty, and poverty in most cases is usually as a result of educational standing, and there are other systematic inequalities that have plagued Black people for quite some time. So, in order for us to really move the needle forward in terms of ending the HIV epidemic, as it has been sort of the plan for the CDC and the United World Health Organization, it will mean for us as Black people to really do everything that we can in our communities to ensure that at least the messaging is timely, the messaging reaches the people that we intend to reach. So I'll leave it at this point so at least Ebony can come in.
Mm. I agree, Noah. Thank you. I think that in the Black community, especially here in Indiana, there is definitely a rise in HIV/AIDS, and it's mainly due to a lot of to the healthcare system, to substance abuse, drug issues in our communities, and the resources not being there for them. I think as well as just the history of poor health care for Black people all around. So there's the stigmatism of being afraid to go to see what's happening. A lot of Black people are living with HIV and AIDS and don't know that they are living with HIV and AIDS due to the lack of being of the resources being there, the lack of uh, medical care.
So I want us to move on with this conversation, and talk about, because I mean you've both talked about the inequalities that exist, and you've talked about issues around policy and challenges that are there, and Ebony talked about the contact tracing. And I just want us to bring Ebony back on contact tracing and just talk about how do you handle um, how do you handle stigma, how do you handle clients, for example, that feel that they cannot access some of these services because they feel like, wait, I can't go to that place, I can't do this because people are going to see that this is what is happening to me. Just how do you handle that?
As someone as a DIS and with contact tracing, I run into that all the time, especially with Black people. Um, so for me, my questions are, what are your fears? What is your challenge? And so I listen to them and hear them out. And a lot of times it's, well, I don't want people to know. I don't want my family to find out. I don't want to go there, or I know someone who may work there, and those fears. So giving them options, hearing them out, because that is a true concern for them, and them, validating their fears, and giving them options. That there's other places that they can go, usually in their community, um, that they can go and they can get tested and they can get treated, um, and informing them on what I know in the best way possible, and letting them know that I'm there for them, that the community is there for them, and that we'll be there with them the whole way, and just making that linkage for them, being that link for them. Not only am I telling them where to go and what services that this facility may provide, but also I'm also reaching out to the facility and I'm talking to them before they get there to let them know that, I have talked and spoken with someone who has some concerns, and this is what their concerns are. And how can you assist me with helping them make this the best, um, you know, assist them in getting treatment, assist them in getting tested. And a lot of times it goes real smoothly. And I mean, even with just the contact tracing within itself, that's a major tool. That's and just a reassuring them that we care for them. We want what's best for them, and that someone who has possibly infected them also cares for them, and that they're not in this alone, and that there are options, and that there's treatment out there, and this does not have to be the end for them, and that as a community as a whole we are there.
Yeah, I mean, I'm just seated here and I'm thinking about how different, interventions here in the
Hmm.
US are from the rest of the world, because I'm not sure if I know of other places in the world where they do contact tracing for HIV/AIDS.
Hmm.
Honestly, I don't think so. But when you talk about, addressing the issue of stigma, I'm seated here and I'm thinking about, personal experiences, interacting with some individuals. So in my past life, I started off work, in the nonprofit sector in an HIV/AIDS organization. So that's why I'm
Hmm.
so passionate about this, and I can actually sit here and have this conversation because I know how important this is. So I worked in the accounts department. I'm trained accountant. I worked in the accounts department for an organization called the Copper Belt Health Education Project back home in Zambia. And what we did is we did health education. We did health education on HIV/AIDS, other sexually transmitted infections. We did tuberculosis work, education around tuberculosis. And so to me, to have conversations around public health and issues around HIV/AIDS is just part of what I was raised, to
Hmm.
do in my earlier days in my career. But what I see is that even if we've made a lot of progress in terms of giving people the assurance and the confidence that there's all these services that are available, the issue of stigma just doesn't seem to go away. I'll give an example. A few years ago, one of my colleagues, one of the people that I have great respect for, Dr. Justina Mutale, she's a Zambian, she's based in the UK. She's been running this global initiative called Positive Runway. And, the organization is a social change organization. They ended up getting recognition from Florida, because we know in the US, Florida has the highest HIV/AIDS infection rates.
Hmm.
So they got recognition from the governor there, on the work that they were doing. And so I tried to highlight some of her work on my own social media. That time I used to be very active on Facebook. And what used to happen is you just put with your lipstick a red ribbon on your
Hmm.
cheek and get a picture and you post that and you write a message. So we stop the global spread of HIV/AIDS. I did that. I put a red ribbon on my cheek and I took a picture and I put a message there. And then I got so many people sending me messages in my inbox. Why are you doing this? What is going on? What not? And I'm like, wait, why am I getting all these kind of
Hmm.
messages, people telling me to pull this down? That really, really shocked me. And then I wanted to start saying, should I ask these people if they have gone to get tested themselves? Because that's the most important thing.
Hmm.
The most important thing is you need to go and get tested, know your status, and then you have a free mind. And then I was like, if I start doing this, then I'm going to start a fight, and I don't want to start fights with people. But that experience taught me that there's a lot of stigma, even for individuals that work in this space.
Hmm.
I would be happy to know your personal experience as well. Do some people look at you and say, wait, why are you doing this? And why do
Hmm.
you do this? Do you face any kind of stigma as a result of your work in this space?
Oh, definitely. I definitely face stigma. Up until I started working as a DIS, I worked in addictions
Mhm,
for off and on for 20 years. And so people would always ask me why I did that type of work as well.
mhm,
People stigmatize, I believe, what they don't understand or
mhm,
what they're afraid of.
mhm,
And so, I always say working with people and working and advocating I want to use the word advocating on behalf of people is not for the faint at heart.
Mhm.
Um, it is definitely a work that you are called to do, because it's not for everybody. And as you see, they don't everybody does not understand why we do the work that we do. But there is definitely stigmas that come with this type of work. Um, During contact tracing, we are calling patients to confirm or sometimes even tell them of their positive status. They know that they were tested, and they're even though they may have signs and symptoms, they're not ready for what we have, for the information that we have for them. And then after that, we're calling their partners and informing them of their possible exposure. And so there's stigma. So the stigma is, as even as a healthcare worker, I'm the bearer of bad
Bad
news.
news.
you know. Um and so we have to change that, you know, that I'm yes, I may not be giving you the news that you want, but I also am bringing hope.
Yep.
I am also bringing a change. Yes, this is going to be a change for you. And a lot of people, including myself, are afraid of change. We look at change as a bad thing. Change does not have to be a bad thing, it can be a good thing. And some things have changed over the last 40 plus years with this AIDS epidemic here,
Mhm.
that is not, we don't have to live that way anymore. And so there have been some good changes. And so we need to emphasize and, you know, really, really press and encourage people and show people that this is not a death sentence anymore, and that there are some changes and there are some programs. And people get bad news and they immediately think about their lives, they think about their children, they think about their spouses, their families, and they think about their funeral. They're ready to plan their funeral. But when I do contact tracing, for me, I'm not calling to just give you information that's going to change your life. I also want to give you hope.
Mhm.
I want to give you something to hold on to. Yeah.
Okay, welcome back. And this is a very, very interesting conversation that we're having here. And thanks a lot, Ebony. Thanks a lot, Mr.
Thank you.
Ndhlovu, for sharing your knowledge on these issues and just, passing on the information, so people can know that there is hope and people can know that they need to go get tested. People can know that, if they're at higher risk, they can participate in a PrEP program, pre-exposure prophylaxis program. So I'm seated here and I'm thinking, okay, so I'm a scholar and I've seen COVID-19 unfold before us start. We're still in the pandemic, and I have seen HIV/AIDS around us for a long time, and seen how families are impacted and affected, and how individuals are impacted by the HIV virus. But then I also have a good understanding of issues around funding. And I think that's really where the issue of equity comes in. If we're really going to have to achieve equity to end HIV, putting ourselves to that test basically means being able to put in more resources and to have more programs like this that give people hope, but then also programs that get us to stop and to think, wait a minute, so we had COVID and we had this huge amount of global response in COVID. you know um, can we get to a point with the fight against HIV/AIDS to be somewhat similar to what we saw with COVID? you know can we get to the point where we would say with certainty that yes, I know there's ending the pandemic by 20 sorry ending it's called the HIV epidemic. And that's the other thing that I keep grappling with. Why are we calling it the epidemic? It's killed lots of people. It's been with us for a very long time. And we call COVID a pandemic. Honestly, I don't know. Those are technical issues, that, that I would leave to you experts to talk about. But what I want to ask is, what can we learn from the response towards COVID that can be applied to the HIV AIDS epidemic going forward? What lessons can we pick from the current fight of COVID that we can use in HIV and, make headways in that direction?
Mhm. Yeah, so I think, thank you, Dr. Sombo. I think the lesson that we can learn from the response that we've seen for COVID 19 or the SARS 2 is that there was a concerted effort from all governments around the world to address this and confront COVID 19 head on.
Mhm,
So there was excess funding. I remember in the Trump administration when uh, the making of these hand sanitizer and things like that. So different companies had to be repurposed to ensure that at least their all hands were on deck to ensure that
Mhm.
at least there was that participatory approach in ensuring that COVID 19 was sort of brought to a complete halt. So we don't really see that when it comes to HIV because I think I've heard others say it could be because it disproportionately affects just one racial group mostly than others. So I think maybe that's what others are saying could be part of the reason. But I think there is need for the African and Black communities to ensure that at least there is a lot that is being done in-house to ensure that at least there is funding, there is research which is directed to ensure that at least there is a lot of people who are doing everything possible to ensure that at least this pandemic is something that we do not
Mhm.
see it dragging on if let's say the next 10 15 years and things like that. So this is why I mean initiatives like prep are very key at stamping this epidemic. And also, there's also just the, I don't know, maybe it's just the stigma, just like you mentioned, Dr. Sombo.
Mhm.
Stigma is one of those things that I think, because for some of us who work in HIV, people will be like, why are you working in HIV? Is there something that you're not telling me and things like that? So there's much more that we need to do
mhm,
on our own so that
Mhm.
because charity begins at home,
mhm,
so that at least we have to be the first movers. I
Mhm.
that there are initiatives, for instance, they say nothing for us without us and things like that. So I think
mhm,
it is important for for the global community to ensure that at least this is not something that is forgotten because it's been around for some time. I mean, back in the early 80s when some of us were still very young,
Mhm.
it's almost 40 years later, we're still talking about HIV. Obviously, of course, there's been so much progress that
mhm,
has been made in terms of the technical advancement in the different regimens that for those who are living with HIV, they can take back in 87 when AZT was approved by the FDA. And
Mhm.
we have, I mean, the long acting PrEP and we have treatment as prevention. So it's important, I think, for us not to lose sight of this pandemic, or I mean epidemic, to ensure that at least we are not only hoping, but we are taking it upon ourselves because when you look at the numbers, I mean, like they say, numbers don't lie. Numbers
Mhm.
don't lie. The prevalence is very much uh, mostly for one racial group. So it's important for that racial group to do everything possible that needs to be done. It'll be nice to see the response that we saw from COVID 19, where all hands were on deck, but unfortunately, that's not the case.
Mhm.
So it's important for us, I think, as Black people to reach out to all these Black people who are in the very strategic positions, especially the now we live in a world of influencers. So
Mhm.
people like those people who are, I mean, people like Michael Jordan, for instance, people like LeBron James, I mean, the Oprahs of this world. I know there are some schools that Oprah, she's been funding and helping in South Africa and other parts of the world. But I think we just need a lot more people to jump on. And also, people need to not say this is a disease which is as a result of promiscuity and
Mm-hmm.
things like that, because we're seeing that especially in the southern states where it is commonly referred to as the Bible Belt. So there is this push, there is this resistance that we are the Bible Belt, and HIV is a disease which is as a result of certain activities, and we don't condone all such
Mm-hmm.
activities. But unfortunately, that is sort of adding fuel to the
Mm-hmm.
disease. So this is why if we can change those mindsets, because that sort of breeds into the stigma. So I think I'll end it at this point to let Ebony sort of chime in.
Yeah. And I just want to thank you, Noah. I want to chime in where you left off with stigma. Stigma is a huge thing. And as African American people, Black people, um, we have, when it comes to um, HIV or, as you said, with, the Bible Belt, MSM, or the LGBTQ community, um, it's not just a disease that affects people who are homosexual. It doesn't just affect that. It affects everybody as a whole because this disease is not just transferred from having, you know, sex. It doesn't happen just that way. But like I talked about earlier, intravenous drug usage is another way in our community. And I remember years ago, we had in the Black community was the crack outbreak. And now we too are fighting this opioid epidemic, but I believe it should be a pandemic because it's a worldwide thing, which is in our communities as well. And it's not being addressed and it's not being talked about. And like you said with COVID, there it was all hands on deck. I remember working in a clinic at the time, and even though we were there and we were providing treatment, that was our main focus was safety. Protecting the lives of the staff as well as the patients that were there. So this has to be an all hands on deck. I agree with you, Noah. All hands on deck mentality that we have to be. Years ago, and I'm probably dating myself, there was a clothing line, FUBU, that stated "for us, by us." And this is the way we have to think about this as Black people in our communities. It has to be by us and for us. We have to come up with something to protect our people, to give them this information, to let them know that this is not a death sentence, to let them know that there's treatment out there, where to go get tested at. Let's just start there. Let's just start with simple testing. You know, let's not even focus so much on the infection itself, but let's just one foot at a time, one thing at a time. And let's just start with just getting you tested. Let's set up testing at churches, at the grocery store, you know, at the Boys and Girls Club, the basketball court where we as Black people frequent, you know, at the club, you know. Let's be there. Let's make it where they can it's available to them. In every other culture there's treatment, but not in the Black community. We have facilities where we can go and get tested and we can go and get treated, but it's not where it's generally accessible or where people know where even to go. So, we have to go out into the community and hit the ground running. And it has to be for us and by us. And, I definitely believe that, we have to erase this stigma because our people are dying at alarming rates. And, it's up to us to make sure that this changes.
Thank you so much. I really appreciate I really appreciate your comments and your sentiments on how we can make a difference and how we can learn what the COVID-19 response has been like, and
Hmm.
sort of superimpose that on our response towards HIV/AIDS going forward. Setting testing centers everywhere. I mean, we had testing centers almost everywhere. And we had free test kits, that I got test kits
Hmm.
from US Postal Service. I just needed to go on the website and say that I need kits. And to this day, there's some schools that you go to for certain activities. They will give you test kits. And you'll be able to get a test when you get back home to know whether you have
Hmm.
COVID or you don't have COVID. And that's a kind of massive response that probably we could learn and use in the fight against HIV/AIDS going forward. So, are there any other last words that you'd like to say, Mr. Ndhlovu, on this very important conversation as we celebrate and commemorate World AIDS Day?
Yeah, so thank you again. It's been a pleasure having this conversation, having this moment to share some thoughts. I think in order for us to fully and seriously address the ending the HIV epidemic is gonna require all hands on deck. The approach that we saw for COVID-19, where everybody sort of came to a standstill and say, let's all focus on this. And so the government had to, I mean, the administration at the time, the Trump administration, they had those almost every day or
Hmm.
updates. These are the numbers. This is where we are, and sort of giving that type of approach. I think that will clearly make a huge difference. And I still have COVID-19 test in my house here. So if we could emulate that system where everybody's on board, we create a hotline where people can call and get the test, and their centers set up everywhere, pretty much the system that we use for COVID-19. I think that will drastically make a huge impact. And obviously, I didn't get a chance to talk a little bit more on U equals U. So there is also another initiative which is called U equals U, which simply means when the when a person is taking their dairy regimen or their HIV medication, it gets to a point where the virus in the body is completely reduced. So when it's completely reduced, it gets to a point where it's undetectable. And when it's undetectable, which means it's untransmittable. So I think that is also one approach, because if people are taking the medication as prescribed, then the virus is reduced in the body and they are able to even have children, because I think we've seen this in different parts of the world where if you are adherent to medication, which means you can live your life just like anybody else. So HIV is no longer a death sentence. There are initiatives that have been put in place. So all we need to do is to get these initiatives, all these strategies that are out there to the people. And if we could emulate the system for COVID-19, then definitely, ending the epidemic is
Hmm.
that is feasible. Thank you, Dr. Sombo.
Thank you. Ebony, your last words on this conversation today.
Yes, thank you. I would just have to just agree with Noah. We, as a people, have to teach our people how to advocate for themselves,
Mhm.
and we do that by educating, getting out into the community, and going into those areas that nobody wants to go into those high crime areas and those low poverty areas and talking to people, educating people, testing them. You have to bring the test to them because they don't know where to go or even if they should. So testing them. And then from there, you know, talking to them and linking them to resources that are in the community, creating more resources and making our state officials hold them accountable for our community. We all of us here on this panel today are educated and very intelligent. And so we have to use what we have been blessed with to bless our community. We are the ones who go back and we reach back into our community and empower our people. And it starts with us, and it starts by, informing and educating. And then, like I said, in holding our state officials accountable for the resources and the lack of funds. But if we don't do that, if we don't stand up, we're going to lose a lot more people. So,
Thank you so
advocation.
much.
Yes. Thank you.
Thank you. I really appreciate that. So, in ending this conversation, I just want to commend the global leaders that are doing a lot,
Hmm.
continuing on with this fight against the HIV/AIDS epidemic, pandemic. And I think specifically to mention that at the last meeting that was held for pledges, I think the US government pledged that they were going to contribute could be about $6 billion towards that fight. That's a lot at a global level. And other countries like South Korea, I think they upped their contribution to about 300%, from what they had given. And also, a number of countries in Africa have been making their contributions towards the Global Fund to end HIV and AIDS. So all those big, huge global initiatives are very, very commendable. And from this conversation, what I am carrying on is if we really are to make this conversation a conversation for the past, so we can just learn from it, and for us to be able to live the theme, putting ourselves to the test. To put ourselves to the test would really mean, doing what we haven't done in the past. If we haven't individually gone to get our HIV test done, that should be the first test that we do. If
Hmm.
we have not been able to allocate resources in communities that have high poverty levels, in communities that are under resourced, putting resources in those communities would be the next set of tests that we put ourselves to. And that's the only way that we'll be able to achieve the equity that is needed to end the HIV/AIDS epidemic, the HIV/AIDS pandemic. So I want to thank you so much, Mr. Ndhlovu, for featuring on this conversation today and sharing your knowledge. I want to thank you, Ebony Crawford, for your work as a disease intervention specialist and for making valuable contributions to this conversation today. Thank you so much.
Thank
Thank
you.